and the primary reason is the panel. Those of you here offer, I think, the nation a great perspective on this issue. And I grew up in an all-black neighborhood in Texas, and we were only a few yards away from the waste treatment. Well, actually, it did not get the sophisticated name of waste treatment plant until a few years ago. But you know, I also realized that the incidence of some diseases, most particularly asthma, is highest among African Americans, and when you look at where the waste treatment plant was and also where the city dump was located, you see that that's about a 99.9% African American community. And I note that Dr. Batts, you use your term disproportional vulnerability, I think, that caught my attention earlier. And is the climate change and environment placing at risk the poorest people, the people of color who live in areas where we've chosen with some great intentionality to locate these facilities that emit, I think, at least at the least unpleasant odors and maybe even some other particles that would be damaging.
Yeah, this is a very good point regarding the different portions of the population that would be most vulnerable to climate change. And what we're dealing with when we talk about climate change are extremes in environmental conditions, be it a heat wave, a flood, a drought, or severe storm. Certainly, we know that it is the poor that are most at risk in heat waves, especially the poor elderly. As far as flooding, you know, people that live in floodplains would be more at risk. And when you deal with ozone pollution, it is true that African Americans do have a higher rate of asthma. So there are certainly, when you look at Hurricane Katrina, which simply was we don't know. Well, I won't make any judgments about why it occurred. But when Hurricane Katrina hit, it really was the poor and mostly African Americans in New Orleans that simply did not have the means or the ability to get out of town and avoid that disaster. So I think to the extent in this country, absolutely there are populations at risk that are primarily the poor. And if you look globally, it's the same situation. Compare sea level rise in Holland versus Bangladesh, and you can see that a population with very little capability to react is at more risk.
Thank you. Dr. Benjamin, would you say that there are things in landfills that could become airborne that would do damage, medical damage to people who live nearby?
Absolutely. Obviously, there are lots of things dumped in landfills that are toxic. If you really look at, there are probably 4 broad areas that disproportionately affect vulnerable communities, particularly minorities. One, more vulnerable to extreme weather events, much more lower baseline health status, and then you place people in near toxic environments like that, and then as a community, the community capacity to recover is diminished. So all 4 of those things, including the toxic issues that you're concerned about, are measures that need to be paid attention to.
I've gone down to New Orleans twice. We've held hearings down there. The flood was one issue, and that was terrible and devastating. I had a son down there in college at the time of the flood. The issue that I'm concerned about more now than the flood is when we went down there, we all had to wear masks when we went into the Ninth Ward. There is I grew up in public housing. There's a stench down in New Orleans like nothing I have ever experienced in my life. And of course, the landfill was washed into the Ninth Ward. And my fear is that we don't know the damage of Katrina right now, that it may not come into fruition for a few years down the road. But I cannot imagine that we are not going to have some prolonged damage to lungs and probably much more in the years to come. Do any of you have any comments on it? My time has expired, but do any of you have any comments?
I second your concern, and I also want to emphasize that it's children who are reaping the permanent harms from these exposures, and because they have a longer shelf life, they will suffer those harms for longer periods of time than an adult who was exposed in the same event. So we need to consider children especially when we think about these kinds of disasters and environmental harm.